In this video, we discuss Torus Mandibularis. Torus Mandibularis is a nodular protuberance of mature bone that occurs along the inner surface of the mandible at the level of the canines and premolars. Histologically, they show normal lamellar bone. The etiology of tori is assumed to be due to genetic factors. It is often bilateral and asymptomatic, and slow-growing. Torus palatinus is more common than Torus mandibularis and occurs in the midline of the hard palate. The presence of both conditions in the same individual is not uncommon. The radiologic appearance and location are characteristic. No differential diagnosis is needed. These are essentially leave-me-alone lesions. Fractures of tori were reported as a complication. When considering treatment, surgical removal is recommended only when the tori interfere with a dental prosthesis or cause chronic trauma due to their size and location. They can be used as a bone grafts for dental surgery.
If you like the video, you can like it, comment it, and share it with your friends. If you are not subscribed yet, please subscribe and click the bell button.